6.8 million African Americans living in the United States mistrust doctors. 20% of African Americans are more likely to report serious psychological distress than adult Caucasians. African Americans living below poverty are 3 times more likely to report serious psychological distress than those living in poverty. Oftentimes, therapists are unable to relate to their African American patients in general and will misdiagnose the patient. Therapists who have negative stereotypes affect therapeutic relationships with their African American patients, which ultimately leads to no positive result for the patient. Depression, anxiety, sadness, hopelessness, and worthlessness are normal dysfunctions that are usually self-medicated with alcohol, drug use, and erratic behavior. Therapists who are not open to African American patients usually use color blindness as a way to not address African American issues with racial differences and difficulties. If you believe that you are being discriminated against by a therapist just because you're African American, you need to find a new therapist. And you need to report that therapist, as discrimination has no place in today's society. As African Americans who believe that we should be silent about what we're going through, where we were taught to go speak to the pastor, read your Bible, pray to God. If you are feeling as though that you need to speak to someone, do not harm yourself, do not harm others. Go seek help. That is the best thing that you can do for our community. 6